midline. Is that clear? Okay. So this image will tell you everything. For the processes to come together, there is an inherent force which has to happen for them to come together and merge. If the inherent force is missing due to some reason, palate will not fuse. Okay, remember that point number 1. And if there is some block in between, something is blocking so that they are not able to fuse, then also palate will not fuse. Okay, so that will lead to cleft palate. Why am I giving so much of importance to cleft palate? What will happen to a child who is born with cleft lip and cleft palate? Tell me. Nasal regurgitation. Just a drop of milk. If it goes, it will just immediately go to the nasal cavity and it will start irritating. You know, sometimes when you try to put water, it goes to the nasal cavity. It will give such a irritating feeling. You will take some time to settle down because nose is for what? To filter air only. It cannot handle any other liquid except the fluids which are formed from the mucous glands, which are very mucinous in nature. It can handle that. But even plain water will irritate. Okay, so that is very sensitive. It is kept there. But even a small drop of milk which the child suckles will just go and hit, and immediately it will be so troublesome and so painful to the baby. Okay, so it is a very difficult thing. So the first function which the surgeon will try to do, or the pediatrician will do, is to obturate. What is obturation? Close that with some device. So we call that as palatal obturators. Now coming back to the force which needs to pull them together and the molecules which needs to be present for fusion are all very, very important. So they can be affected by improper nutrition, stress and chemicals, endogenous chemicals. Endogenous chemicals means what you take from outside can damage this and can cause cleft lip. The same thing happens for the lip also. Lip fuses from the two maxillary processes coming together. In between, who is there? Medial nasal process is there for the filter. Okay, so there can be fusion defect in this and fusion defect in this side. Okay, so that is how it is. And again for palate, remember we told primary, secondary. So the clefting can be in this direction or in this direction. Those can be like this, or it can be bilateral. So like that. Sometimes there will be only midline clefting. So it can be variety depending on the planes of fusion. Is that clear? So that is why you should remember palatine process very, very clearly. So to put a easy diagram like this. Okay. So fusion will happen here. Sometimes the cleft will happen like this, or it can be a Y-shaped defect also, whichever. And lip again, you know that medial nasal process is like this. Either it will not fuse on this side or it won't fuse on this side. If both sides are not fusing, the medial nasal process will hang at the center like this. Okay, so it will hang at the center like this, and that we call it as a hair slip. Hair is a rabbit. Hair slip at a rounded projection like thing. So those are for understanding cleft lip, cleft palate. You will do them multiple number of times in your later years. Right now you should understand why is that happening. Okay, because you are learning about formation of palate. Okay. Development of tongue, I am sure you have finished in anat, but again as a quick thing. Now recollect, what are occipital somites? Occipital somites are a group of embryonic blocks which are giving rise to muscles. So this occipital somites are the ones which give rise to intrinsic muscle of the tongue. Is that clear? So that is what you have to remember when you are remembering the development of tongue. So look at this. So here there are two things which you must remember. So what are the parts of the tongue? Anterior 2/3 and then posterior 1/3, and then you have the epiglottis. So anterior 2/3 is by the lateral lingual